welcome to the first fill. My name is Haley Mook, and I am the Senior Manager of Custom Education here at APHA. This month, we are reviewing recent updates related to medication safety and are happy to provide you with that valuable medication safety CPE for listening. Be sure to head to the Learning Library to ensure you don't miss out on your CPE credit. In this episode, I'm going to discuss a recent FDA labeling change for the use of thiopurines during pregnancy. So as a quick review, azathioprine, 6-mercaptopurine, and 6-thioguanine belong to the thiopurine class. So these medications are immunosuppressive agents with FDA-approved indications such as rejection of renal transplantation, rheumatoid arthritis, acute lymphoblastic leukemia, and acute non-lymphocytic leukemia. However, azathioprine and 6-mercaptopurine are commonly used off-label to treat inflammatory bowel disease, including Crohn's disease and ulcerative colitis. Additionally, they have been able to treat systemic lupus erythematosus. Additionally, the American Gastroenterological Association and the American College of Rheumatology include azathioprine and 6-mercaptopurine in their respective treatment guidelines for the treatment of these off-label conditions during pregnancy on an individualized basis. In April 2024, FDA released a drug safety communication alerting health professionals that thiopurines have been associated with the rare risk of intrahepatic cholestasis of pregnancy, or as I'll refer to it, ICP. So ICP occurs when bile acids do not flow properly from the liver to the gut and is most commonly seen in the late second and early third trimester of pregnancy. ICP has been associated with an increased risk of adverse outcomes for the baby at birth. Common signs and symptoms of ICP include generalized, and I'm really emphasizing here, intense pruritus, specifically in the palms of hands and soles of feet, particularly at night, with an increased serum bile acids and elevated liver function tests. So jaundice can occur with ICP, but it is not seen in all clinical presentations of the condition. So just highlighting that important feature there. While not cited in the drug safety communication, a prospective multi-center cohort study published in the Journal of Crohn's and Colitis in February 2024 assessed the relationship between ICP and thiopurine use in pregnancy. The study participants were composed of pregnant persons diagnosed with inflammatory bowel disease, primarily Crohn's disease, and were prescribed either azathioprine or 6-mercaptopurine or a biologic monotherapy. 131 patients received thiopurines and 147 patients received biologic monotherapy, so we're seeing a very small sample size here. 6.7% of the pregnant persons receiving azathioprine or 6-mercaptopurine experienced ICP compared to 0% of participants receiving a biologic, which researchers deemed to be statistically significant. Additionally, study authors hypothesized that the risk of ICP may be increased by the presence of thiopurine shunting or following a dose increase antenatally. So now that we've covered thiopurines and the associated risk of ICP, let's talk about what label changes are coming and the role that pharmacists can play in discussing this new change with patients and other healthcare providers. FDA is requiring all new drug applications and abbreviated drug application holders for thiopurines to include this new information in their label. So, post-marketing cases of ICP have been reported in individuals treated with drugs in the thiopurine class during pregnancy. ICP symptoms and elevated bile acid levels improved following azathioprine discontinuation, and pregnant persons should discontinue use of thiopurines if they develop ICP. So those are the FDA requirements for all new labeling for thiopurines. And finally, pharmacists can communicate these additional warnings to patients who are pregnant and taking a thiopurine, review the signs and symptoms of ICP to look out for, and recommend that they contact their physician immediately if they notice any concern related to ICP, so that pruritus, the potential jaundice, and additionally, pharmacists can direct patients or physicians to complete and submit the MedWatch online voluntary reporting form. Like all medications and classes, thiopurine use in pregnancy should be evaluated on a case by case basis. Shared decision making should be used to evaluate the risk and benefit of starting or continuing thiopurines during pregnancy while keeping in mind the potential for ICP. That wraps up our time today. Remember, this month by logging to APHA's Learning Library and completing a quick assessment and survey, you'll earn a half hour of medication safety CE. See you next time on the first fill.